Introduction to skin anatomy. The skin, our body's largest organ, is a complex and intricate structure vital for maintaining homeostasis and protecting us from the environment. It performs critical functions such as regulating body temperature and facilitating sensory perception. Composed of three primary layers, the epidermis, dermis, and hypodermis. Each layer possesses distinct characteristics and roles. Together, these layers work synergistically to ensure the health and functionality of the body's outermost system, covering an average surface area of about 2 square meters in adults. The epidermis, outer protection. The epidermis, the outermost layer of the skin, acts as a primary protective barrier against physical, chemical, and microbial harm. It is primarily composed of keratinocytes, cells that produce keratin, a protein essential for the skin's strength and waterproofing. This layer is further subdivided into 5 distinct sublayers: the stratum basale, stratum spinosum, stratum granulosum, stratum lucidum, and stratum corneum. The stratum corneum, the outermost of these, is continuously shedding and renewing, a process known as desquamation, which replaces approximately 40,000 skin cells every hour. Epidermal cells, melanin and immunity. Within the stratum basale, the deepest epidermal layer, melanocytes are responsible for producing melanin, the pigment that gives skin its color and provides crucial protection against ultraviolet UV radiation. The amount and type of melanin determine an individual's skin tone and natural sun protection. Langerhans cells, a type of immune cell, are also scattered throughout the epidermis, playing a key role in recognizing and combating pathogens. These dendritic cells act as sentinels, capturing antigens and migrating to lymph nodes to initiate immune responses, forming a vital part of the skin's defense system. The dermis. Strength and support. Beneath the epidermis lies the dermis, the thickest layer of the skin, providing crucial structural support and elasticity. This layer is rich in connective tissue, primarily composed of collagen and elastin fibers, which are responsible for the skin's strength, flexibility, and youthful bounce. The dermis is divided into 2 regions, the papillary dermis and the reticular dermis. The papillary dermis, the uppermost portion, contains finger-like projections called dermal papillae that interlock with the epidermis, enhancing the connection between these layers and increasing nutrient exchange. This intricate connection is vital for skin health, as the dermis supplies the avascular epidermis with essential nutrients. Dermal components, glands and nerves. The reticular dermis, the deeper and thicker portion of the dermis, contains dense collagen fibers, sweat glands, sebaceous oil glands, hair follicles, and an extensive network of blood vessels. This layer plays a vital role in thermoregulation and wound healing, housing fibroblasts, the cells responsible for producing new collagen and elastin. It also houses capillaries, lymphatic vessels, and sensory nerve endings, which are crucial for detecting touch, temperature, and pain. For instance, the dermis contains mucinous corpuscles for light touch and Pacinian corpuscles for deep pressure and vibration, allowing for a rich sensory experience of the environment. The hypodermis, cushion and insulation. The hypodermis, also known as the subcutaneous layer, lies beneath the dermis and serves as a crucial cushion, protecting underlying muscles, bones, and organs from impact. This layer is primarily composed of adipose tissue, which stores energy in the form of fat and provides essential insulation to regulate body temperature. The thickness of the hypodermis varies significantly throughout the body and between individuals, influenced by factors such as age, gender, and overall body composition. For example, it is typically thicker in areas like the buttocks and palms, providing extra cushioning and insulation, and also contains connective tissue, blood vessels, and lymphatic vessels for nutrient delivery and waste removal. Skin's barrier function. A critical function of the skin is its role as a robust barrier to environmental aggressors, preventing water loss and blocking the entry of harmful substances. The stratum corneum, the outermost layer of the epidermis, is particularly important in this regard, consisting of dead, flattened keratinocytes embedded in a lipid matrix. This layer undergoes a continuous process of shedding and renewal, known as desquamation, which is essential for maintaining the skin's integrity and function. Furthermore, the acid mantle, a thin, slightly acidic film on the skin's surface with a pH of 4.5 to 5.5, further enhances its protective capabilities by inhibiting the growth of harmful bacteria and fungi. Thermoregulation by skin. The skin plays a vital role in thermoregulation, maintaining the body's internal temperature within a narrow, healthy range. Sweat glands, primarily located in the dermis, produce sweat that evaporates from the skin's surface, effectively dissipating heat when the body is overheated. Blood vessels in the dermis can dilate or constrict to regulate blood flow and heat loss. For example, when the body is overheated, vasodilation occurs, increasing blood flow to the skin and promoting heat dissipation, which can release up to 80% of the body's heat. Conversely, in cold conditions, vasoconstriction reduces blood flow to the skin, conserving heat. Sensory perception of skin. Another essential function of the skin is its role in sensory perception, allowing the body to detect and respond to external stimuli. The skin contains specialized nerve endings and sensory receptors that detect touch, pressure, vibration, temperature, and pain. These receptors, such as Merkel cells in the epidermis and Meissner's and Pacinian corpuscles in the dermis, enable the body to perceive and interact with the environment. For instance, the fingertips, rich in Meissner's corpuscles, can detect textures with incredible sensitivity, allowing us to differentiate between surfaces as fine as a single hair. Skin repair and regeneration. The skin's remarkable ability to repair and regenerate is a crucial feature, triggered by a complex cascade of events when injured. The wound healing process is typically divided into 4 overlapping phases: hemostasis, inflammation, proliferation, and remodeling. During the proliferation phase, fibroblasts produce new collagen and keratinocytes migrate to cover the wound, forming new tissue. The remodeling phase, which can last for months or even years, involves the maturation and reorganization of collagen to restore the skin's strength and function, with scar tissue often reaching 80% of the original skin's strength. Skin microbiome. The microbiome of the skin plays a crucial role in maintaining skin health, as it is home to a diverse community of microorganisms, including bacteria, fungi, and viruses, that live in harmony with the host. This intricate ecosystem provides protection against pathogenic organisms by competing for nutrients and space. It also contributes significantly to the skin's immune function by interacting with immune cells and modulating inflammatory responses. Disruption of this delicate balance, often caused by excessive use of harsh cleansers or antibiotics, can lead to various skin conditions such as acne, eczema, and infections, highlighting the importance of gentle skincare. Anatomy's role in fibroblast. Understanding the anatomy of the skin is fundamental for practitioners performing fibroblast skin tightening, as it allows for precise targeting of specific skin layers and structures. This knowledge is critical for delivering safe and effective treatments while minimizing the risk of complications. The skin's inherent resilience and regenerative capabilities make it an ideal focus for aesthetic and therapeutic interventions like fibroblast treatments. A thorough grasp of skin anatomy ensures practitioners can accurately stimulate collagen and elastin production in the dermis, which is key to achieving desired tightening and rejuvenation effects. Health and safety fundamentals. The practice of fibroblast skin tightening, like any aesthetic or medical procedure, demands a comprehensive understanding of health and safety protocols. Ensuring the safety of both clients and practitioners is paramount, as it minimizes the risk of infections, injuries, and adverse reactions. Maintaining a clean and sterile environment is the foundational step in health and safety. This includes ensuring the treatment area is free from dust, debris, and contaminants, and that all surfaces are meticulously wiped down with medical-grade disinfectants before and after each client, creating a hygienic space. Infection control and PPE sterilization is a critical aspect of infection control in fibroblast skin tightening. All reusable tools and equipment, particularly the plasma pen and its attachments, must be thoroughly sterilized before and after each use. Single-use disposable items, such as gloves, gauze, and applicators, must be discarded immediately after use to prevent cross-contamination. Personal protective equipment, PPE, is an essential component of health and safety. Practitioners must always wear gloves, masks, and protective eyewear during procedures to minimize exposure to blood, bodily fluids, or other potentially infectious materials. Clients should also be offered protective eyewear to shield their eyes from the plasma pen's light and accidental contact with fluids. Understanding blood-borne pathogens. Blood-borne pathogens, BBPs, are microorganisms, such as viruses and bacteria, present in human blood or bodily fluids that can cause diseases. Examples include hepatitis B, HBV, hepatitis C, HCV, and human immunodeficiency virus, HIV, which pose significant health risks. These pathogens are most commonly transmitted through direct contact with infected blood, often via skin punctures from contaminated sharps, like needles or plasma pen tips. Indirect transmission can also occur if contaminated tools or surfaces come into contact with open skin or mucous membranes, underscoring the need for stringent hygiene. Sharp safety and waste disposal. Proper disposal of sharps, such as needles or plasma pen tips, in puncture-resistant, clearly labeled sharps containers, is a critical step in infection control. These containers must never be overfilled, as this significantly increases the risk of accidental needle stick injuries, which are a leading cause of occupational exposure. Contaminated materials, including gloves, gauze, and other disposable items, must be disposed of in biohazard bags to prevent accidental exposure. Adhering to local regulations for medical waste disposal is not only a legal obligation, but also a key component of maintaining a safe and environmentally responsible practice environment. First aid and emergency response. Despite meticulous preparation, unforeseen incidents or emergencies may arise, making first aid training a cornerstone of safe practice. Practitioners must be equipped to handle situations like minor burns, irritation, or allergic reactions effectively. For minor burns, the affected area should be cooled immediately with cold water or a cold compress to reduce pain and inflammation. In cases of severe allergic reactions, such as anaphylaxis, emergency medical services must be contacted immediately, as symptoms like difficulty breathing or swelling can be life-threatening. Practitioners should also be prepared to manage fainting episodes by placing clients in a supine position with elevated legs. Key contraindications. Health conditions. Understanding contraindications is equally critical for ensuring client safety, as these are specific conditions or factors that make a particular treatment inadvisable or unsafe. Fibroblast skin tightening involves controlled microtraumas, stimulating collagen and elastin production. Common contraindications include pregnancy and breastfeeding, as hormonal changes can affect healing and pigmentation. Autoimmune disorders like lupus or psoriasis are also contraindications, as they can impair the body's ability to heal and increase the risk of adverse reactions, with studies showing a higher risk of complications in these groups. Contraindications, skin and scarring. Certain skin conditions, such as eczema, dermatitis, or active acne, can also preclude fibroblast treatments. These conditions can exacerbate inflammation, increase sensitivity, or lead to uneven results, making the skin unsuitable for the procedure until they are resolved. Clients with a history of keloid or hypertrophic scarring should be approached with extreme caution, as the procedure may trigger excessive scar formation. Additionally, individuals who have undergone recent cosmetic treatments like chemical peels or laser resurfacing must wait until their skin has fully healed to minimize the risk of overloading the skin and causing irritation or complications. Contraindications, medications, and lifestyle. Medications and lifestyle factors must also be taken into account when identifying contraindications. Clients using isotretinoin, commonly prescribed for severe acne, should avoid fibroblast treatments until at least 6 months after discontinuing the medication, as it can thin the skin and impair healing. Blood-thinning medications, such as aspirin or warfarin, can significantly increase the risk of bleeding or bruising during the procedure. Additionally, lifestyle factors like smoking and excessive alcohol consumption can interfere with the body's natural healing processes, with smokers experiencing up to a 40% slower wound healing rate, and should be addressed during the consultation. Client consultation. Building trust. Client consultation is one of the most critical stages in any aesthetic procedure, forming the foundation of a successful treatment outcome. It enables the practitioner to assess suitability, understand client goals, and manage expectations, fostering trust and confidence. The consultation begins with an initial introduction and rapport building, creating a welcoming environment where the client feels comfortable discussing their concerns. Active listening, warm greetings, and open body language are key skills in this stage, helping to establish a strong practitioner-client relationship. Gathering a comprehensive medical history is also crucial for identifying any contraindications or risk factors. Skin analysis and expectations. Skin analysis is a vital component of the consultation, where the practitioner carefully assesses the client's skin type, condition, and overall health to determine suitability for fibroblast skin tightening. This involves examining sensitivity, elasticity, hydration, and any damage like scars or hyperpigmentation. The Fitzpatrick scale, a classification system categorizing skin types based on their response to sun exposure, is often used during this stage. Understanding the client's Fitzpatrick skin type is crucial for predicting how their skin will respond to treatment and minimizing complications like post-inflammatory hyperpigmentation, ensuring realistic expectations are set for the client's desired outcomes. Procedure explanation and risks. Following skin analysis, the practitioner must provide a comprehensive explanation of the fibroblast skin tightening procedure. This includes detailing how the plasma pen works, what the client can expect during treatment, and the steps involved in the healing process, ensuring transparency. While generally safe when performed by a trained professional, inherent risks and complications must be disclosed. These may include redness, swelling, scabbing, hyperpigmentation, and, in rare cases, infection or scarring. Clients must be informed about factors that increase complication likelihood, such as smoking or excessive sun exposure, and the importance of strict aftercare instructions. Informed consent and customization. Informed consent is a critical legal and ethical component of the client consultation process, ensuring clients fully understand the procedure, its risks, benefits, and expected outcomes. Practitioners must provide a detailed consent form and allow ample time for questions, ensuring the client feels confident and unpressured. Customizing the treatment plan to suit the client's individual needs and preferences is also essential. Every client is unique, and their plan should reflect specific skin concerns, goals, and medical history, ensuring a tailored experience. For example, a client with deeper wrinkles may require a more intensive approach than someone with sensitive skin, which might benefit from a gentler protocol. Pre-treatment and post-care instructions. Before concluding the consultation, practitioners must provide clear pre-treatment instructions to help clients prepare for the procedure. These may include avoiding sun exposure, refraining from certain skincare products, like retinoids or exfoliants, and discontinuing blood-thinning medications with a doctor's approval. Staying hydrated and maintaining a healthy lifestyle are also crucial. The final stage involves discussing post-treatment care and follow-up. Clients need detailed aftercare instructions, including how to care for the skin during healing, what to expect in recovery, and the importance of avoiding touching or picking carbon crusts. Follow-up appointments should be scheduled to monitor progress and address any concerns, ensuring a smooth recovery and optimal results. Conclusion: comprehensive safety. In conclusion, health and safety, first aid, and contraindication management are foundational to the practice of fibroblast skin tightening. Practitioners must prioritize cleanliness, infection control, and adherence to regulatory standards to protect both themselves and their clients. Comprehensive first aid training equips practitioners to handle emergencies with confidence, while understanding contraindications and conducting thorough consultations are essential for preventing adverse outcomes. By maintaining a steadfast commitment to health and safety, practitioners can deliver effective and professional treatments, fostering trust and satisfaction among their clients, and ensuring long-term success in their practice.